Pharmacology Session 19, covering antimycobacterial agents. Mycobacterial agents are going to be things that cause tuberculosis or are associated with tuberculosis. And first of all, I'm just going to do the first line drugs, which include Isoniazid, Rifampin, Ethambutol, and Pirazzinide. First of all, Isoniazid, its method of action is mycolic acid synthesis inhibition. Its metabolism or excretion is in fast acetylators. It's different than in slow acetylators. It has lots of drug interactions, including CYP. It inhibits CYP3A4 and CYP2C19. It also has a risk of hepatotoxicity and peripheral neuropathy. To remember it, since it's called Isoniazid, I put a picture of son. Here's a son. It's a baby boy son. And it says it's through mycolic acid synthesis. A lot of times little babies will get colicky. So mycolic son, my Isoniazid. And also, since you remember this has lots of food-drug interactions, or lots of drug interactions, you think, well, kids have lots of interactions. You can't give them very much stuff because they're little kids. Okay, so next one is Rifampin. Rifampin binds RNA. It's also hepatically excreted, and it induces lots of CYP things, including 3A4, 2C19, 2D6, 2C9, 1A2. And when you take it, for some reason, you have a risk of red-orange bodily secretions. And so the way to remember this is just there's lots of R's here. Rifampin, RNA, reactions. And there's lots of CYP reactions. And also red-orange secretions. So R for RNA, R for rifampin, R for reactions, and R for red-orange secretions. Next, I have Ethambutol. Ethambutol inhibits arabinosyl transferase, and it's secreted, I believe, 80% by the kidney. It said 20% hepatic, so I'm assuming that means 80% kidney. And it doesn't have very many drug interactions. Sometimes I think aluminum and the antacids might decrease its absorption. And when you take it, you have a risk of red-green color blindness, which he had some fancy name for that I can't remember. So to remember Ethambutol, I have Ethambutol kind of has but all in there. So, and also it has the arabinosyl transferase. So I drew a rabbit with a big butt for butol. So here's a rabbit, and he's eating a kidney bean. To remember that it's 80% kidney excreted, and this rabbit is colorblind. So there's a colorblind rabbit with a big butt eating a kidney bean, and hopefully that'll help you remember everything that's associated with that. This next one here is Pirazzinide, and the method of action is unknown. It has something to do with lysosomes or whatever. And its metabolism or excretion is hepatic, but metabolites are renally cleared, so you need to avoid or decrease the dose with renal impairment. Next, there aren't many drug interactions, and this drug can cause nausea or vomiting, and it's contraindicated with gouty arthritis. So for Pirazzinide, I have pirates, and this pirate is vomiting. He has nausea because he's seasick. And you think hepatic because people that drink lots of alcohol sometimes have liver problems, so you associate liver with pirates because they're always drinking alcohol, and you think of this pirate as having gouty arthritis.